May I come in, sir?
Yeah.
Good afternoon, sir. Thank you, sir.
Mr. Yashvardhan, tell us something about yourself to
Sir,
report.
Sir, my name is Yashvardhan Singh. I was born in the Rat town of Hamirpur district of Uttar Pradesh. I did my schooling from Morning Star Children's Senior Secondary Academy, and after that I moved to Lucknow to pursue my MBBS from King George's Medical University, Lucknow. And after that I worked in Department of Sports Medicine as a resident doctor, sir.
Right. You have been given appointment in year 22 and 23.
Yes, sir.
Why didn't you join that?
Sir, the
Which
service
services were allotted to you? And
Sir, the service allocation of around 200 candidate is still sub judice in the Honorable Supreme Court.
what was the reason?
So the reason is regarding the OBC non-creamy layer and creamy layer issues of those children whose wards are in the PSUs and government-aided institutions.
But this year again you have claimed it on non-creamy layer basis,
Yes, sir.
right?
Yes, sir.
Right. Anyway. See, your profession, medical services, has been commercialized, right? And poor people has lost approach to the medicine service, to better medicine services.
Yes, sir.
From where this anomaly crept in, that this gap between the services of the government hospitals and private hospitals has increased a lot, right? How we can do away with this anomaly?
So this, unfortunately, this happened when a patient-doctor relationship transformed to the service provider and client relationship. So everything was commercialized, right from diagnostic to the pharmaceutical industry. So this is the anomaly that has been there. And sir, I think that to plug the gap that is existing between now, we have to focus, the state have to provide certain kind of social security support. It is already doing. But the main problem is that the structure of healthcare system, that should be a paramedical structure, that most of the attention needs to be given to the primary healthcare, and after that secondary and tertiary. So I think that as of now, most of the burden goes to tertiary healthcare centers. So I think that strengthening of primary healthcare sector and focusing on the smooth referral system is the vital element that is required.
Is it not that due to that commercial hospitals or these private hospitals are better equipped and they have better doctors?
So this is also one of the strengths of the private healthcare sector, and it is true that to reach the universal health coverage, we need the help of private healthcare sector. They should be the partner of the government in that regard. But certain practices that can be improved, we need to focus on those practices.
Why this government hospitals cannot compete with private hospitals? Is there any need of a lack of fundings, or there is some other reason for that?
So I think that there are many government institutions. If we see the AIMSs, the several government medical institutions that are par excellence, and they are doing far better than any private hospital of the country. So I think that the issue is that of distribution and asymmetry. Some of the government healthcare centers, especially district hospitals, they are not up to the mark. There is a lack of specialist doctor and lack of infrastructure. So we need to plug those gaps that are existing.
How many medical systems are operating in India?
So currently we have the allopathy medical system, and second system is the Ayush-based medical system, sir.
Suppose you fall ill, which medicine system you would like to adopt for your own treatment?
Sir, I would like to go for the integration, the best possible outcome. If there is related to any preventive aspect or rehabilitative aspect, I will go for the Ayush-based practices. And if it is the emergency situation or certain kind of major surgery, then I will choose allopathic medicine, sir.
Don't you feel that in Indian society there is excess use of medicines, or what is the reason for that?
So the major reason is that various departments exist in silos. If we have any problem related to nephrology or kidney, we go to the specialist, then they start the treatment related to kidney, then we go to gastrologists. So different departments are existing in silos. They are not being integrated. So they follow their own independent protocols. So it leads to the higher uses of medicine, sir.
People are taking medicine without prescriptions. Why it is happening like that?
So there are two reasons. That one is that there might be lack of access to the doctors, especially in the underserved region. Secondly is that with the access to the social media tools and tools such as Google, ChatGPT, they are focusing on self-diagnosis and self-treatment aspect. These are the two major reasons, sir.
Is it not reason that every medicine is available on the over the counters?
Yes, sir. So that this is also
You
a
can
major reason.
go to any medicine shop and without prescription they will hand over you the medicine.
Yes, sir.
How we can check it?
So I think that for this we need a audit framework, that every medical shop or pharmaceutical shop should be audited, that they should not dispatch any medicine without the prescription of the doctor. So sir, auditing is the most vital in this case.
Have you read the budget of this year?
Yes, sir.
What is the allocation to the health department?
Sir, if we combine the biosimilars and biologicals part, it is around 1,10,000 crores, sir.
Yeah, I-10 students are committing suicides. We have the number is increasing every year. What can be the reason?
So I think that suicide need to be looked from the prism of life cycle approach. There are accumulation of several stresses that lead to such activities. I think that professional reasons might be there, personal issues might be there, family issues might be there, financial strains might be there, subtle forms of distress like social relationship distress might be there. So it is a culmination of several kinds of stresses that lead to the drastic step of suicide, sir. So there cannot be a single reason for such a drastic step.
Is there a way out to reduce this?
So to reduce that, we need to focus on the integrated aspect, whole of the society. We need the approach of whole of the society. We need clinicians, psychiatrists, psychologists, counseling specialists. There should be a healthy relationship between the parents and child, healthy relationship between the peers, and healthy relationship between student and teacher, sir.
Right, thank you.
Yashvardhan,
Yes, sir.
what is the meaning of Yashvardhan?
So it one's whose goodwill and glory increases with time.
How do you relate your name with an ancient era king?
So one of the king was named Harshvardhan. He was from Pushyabhuti dynasty, and some of the kings they have been named as Yashovarman also, sir.
Where? In which dynasty?
So, King Harshvardhan was of Pushyabhuti dynasty, and Yashovarman was of Varman dynasty, sir.
You have worked in a department of sports medicine.
Yes, sir.
What is the controversy about it and what is the requirement of it?
So, sir, the several controversies that are related to sports medicine are the issue of doping. Second issue, there have been certain issue like in the Olympics, we missed a medal in the wrestling that was related to weight reduction issue, and the certain issue that are related that we are facing difficulties in providing optimal sports medicine care to our athletes, so that ultimately hampers the prospect of India doing good in global events. So these are the issues that are related to sports medicine.
Why we are not able to do good in the sports medicine despite we have so many large number of doctors and we are supplying them to Western countries?
So one is that the institutions specifically for sports medicine, we have less institutions, limited institutions in our country. Second is related, the specialist, orthopedic specialist cannot provide the sports medicine need of athletes. We need to go for higher specialization. So the specialists specifically in that arena are also less. And even if they are not present at the ground level, because most of the injuries happen at the block level, at the district level. So the preventive aspect is also missing. Currently, sports medicine is focusing on the curative aspect only. So sir, these are the aspects that I think.
So why you have not chosen to take post-graduation in this area?
Sir, I think that I have get certain experience from working as a sports medicine resident doctor. So certain element I get through sports and certain through medicine. And I think that all the elements I can address being a part of civil services, sir.
Recently, the pass percentage, the requirement
Yes,
for
sir.
NEET PG has
Yes,
been
sir.
reduced to -40.
Yes, sir.
What is your take on it?
Sir, in my opinion, it should not have been done, because it do away with the purpose of any examination, because the purpose of any examination is that you should have a qualification mark. If you possess that qualification, only after that you can pursue that course. So I think, sir, we should have certain minimum basic qualification criteria, sir.
So you mean to say the quality will degrade?
So not specifically quality, but if we see the NEET PG examination, that is, although it is a single day examination, but the exam cycle starts from the first day of our medical schools from our MBBS. We have that motivation that we have to qualify for the PG examination. So we start putting our effort from our first day of medical college. If we are sure that we will be able to get medical seat even before qualifying that examination. So the whole education cycle might suffer, sir.
Recently, Honorable Prime Minister has mentioned that India should be or India will be the word pharmacy.
Yes, sir.
What role do you foresee about yourself as a civil servant?
So I think as a civil servant in the field of pharmaceutical, my role would be to focus on research and development. So we are able to get more and more patented drugs, because we are doing very good in generic drugs, but research and development is missing. Patented drugs are missing. So my role will be towards those kind of drugs.
Anything else?
So specifically, I can also focus on biologicals and biosimilars.
Why so many doctors are going abroad, leaving India, despite the government and the public is spending not lakhs but crores of rupees for their education?
So we see there are push factor for it and pull factor for it. If we see from the
You know,
perspective
the
of,
NHS is being run direct is 60% are Indian doctors.
yes, sir.
UK healthcare.
Yes, sir. So the pull factor for it, that most of the Western countries specifically, and West Asian countries also, they want to get the Indian talent, specifically of doctor, nurses and paramedical staff. So they have a kind of system that encourages, they have created certain channels that make it easy for the Indian doctors to go over there. And so push factor are there are certain doctors also who want to go for this specialization in research and development. So they think that
So as a civil servant, you would not like to have a pull factor for them?
yes, sir, I would like to have it, sir.
My last question.
Sir.
What is the scope of India in the biosimilar and biotech area?
Sir, I think that there is a great scope for it. For example, we have several private sector also, like Biocon is there. They are already doing good in biotechnology. If the government will provide a certain kind of nudge and certain kind of policy support, then we have exceptionally well potential. Vaccine sector is already doing good. So if we could build upon and capitalize upon our existing potential, we will be able to do much better, sir.
Yashvardhan,
Yes, sir.
Swachh Bharat Mission. Is it a slogan on paper, or you find something on the ground also?
So I think we have done significantly well, but there is a lot of scope to improve. If we see the targets that were set, we could capitalize on those targets. We did well, but there is a lot of scope, sir.
Bundelkhand is a very backward region, right? Suppose you are made DM of any district, and say Hamirpur, etc. How will you improve the development part of that district?
So I think that although Bundelkhand can be considered as a backward in terms of socio-economic indicators, but if we see its historical aspect, its cultural aspect, it is a very rich state. So my approach would be to capitalize on its richness, to capitalize in its rich culture, to develop the tourism industry over there. And second focus would be to go for the labor-intensive manufacturing sector, like one district, one product, like focusing on food processing industry. And my third approach would be to focus on the health and educational outcome, to create a specific girls' degree college in each and every block of the district, to go for the schools like more and more Jawahar Navodaya Vidyalayas, Kendriya Vidyalayas, and to focus on primary healthcare center and CHC, sir.
Thank you, Yashvardhan. Your formal interview is over.